Hello everyone. So today I'm going to talk about puerperal infection. So I will start this puerperal infection by a small introduction. So puerperal infection is also called the postpartum infection. So first we have to know that what is postpartum. Postpartum means just after the childbirth. So puerperal infection is also called the postpartum infection, referred to any infection like any bacterial viral infection that occur after delivery. Most commonly, the infection involve the reproductive tract, means both the external internal reproductive tract, woman reproductive tract, and can involve other areas such as the breast and urinary tract. So the infection can spread the other areas such as the breast and the urinary systems. Currently, research suggests that the postpartum infection occur in approximately 2% to 8% all the postpartum women. Next, we will see the definition. So, the puerperal infection defined as any types of infection of the reproductive tract that occur during the postpartum period, means just after the child delivery. Postpartum infection is suspected when the woman develop high grade fever and the other symptom like pain and the general symptom like headache, vomiting, etc. Causes is infection of the episiotomy wound or any laceration of vagina, vulva or cervix. So first we have to know about what is episiotomy. So episiotomy, later I will discuss detail about episiotomy. So episiotomy, it is a small incision made on the edges of the vaginal opening to make it larger and make it easier for the baby's head to be delivered. So episiotomy, it is a small incision on the edges of vaginal opening. And next is the infection of the placental site by bacteria or traveling up from the vagina. So it is most commonly seen in the cases of prolongated labor after the repeated vaginal examination or any unsterile condition, or another thing is the cesarean section. Next is the infection of the other pelvic organ like ovaries, peritoneum and the board ligament. Secondary pelvic infection. Next, the infection spreading from the sore throat or infection gum or through the blood or from the anals during delivery. And next one is the infection can also spread from infected vaginal pad. So infected vaginal pad also can cause the postpartum infection. So clean vaginal sterile pad should be used instead of the homemade cloth pad to avoid the postpartum infection. So next we will see the risk factor of this postpartum infection. So the risk factor, first risk factor means the antepartum risk factor, including the history of infection, any previous history or history of the chronic condition. If the mother having the chronic condition like diabetes mellitus, anemia, poor nutrition, or the infection of the genital tract, or smoking or obesity, any bad habits. And internal risk factors are the caesarean bath or the caesarean section. I told before in the causes of the postpartum infection, and or any using any unsterile instrument, or urinary catheterization, episiotomy or laceration, or frequent vaginal examination, prolonged rupture of the membrane, usually more than 24 hours. Next, the sign and symptom of this postpartum infection. So sign and symptom, how we understood, how we detect that it is the infection, postpartum infection. So the patient can experience high grade fever, and pain may be present along with the episiotomy stretches or over the laceration in cases of infection. Next, the general symptoms are like headache, vomiting, nausea, and general malaise can be present. So this is the sign and symptoms. So first is the high grade fever, then pain, And the general symptom, under the general symptom is headache, vomiting, general malaise, loss of appetite, etc. Next is diagnostic evaluation. So first, under the diagnostic evaluation, history collection. Under history collection, we have to collect the history from family side or patient side. So we have to collect the pre-existing infection before liver as chest or the urinary tract infection, and symptom of the infection elsewhere, the cough or the breast pain or the sore throat, etc., and complicated liver like instrumental or the prolonged delivery, previous instrumental or the prolonged delivery. Next is the abdominal examination. Abdominal rigidity, tenderness, uterine size, tenderness, and abdominal masses related the uterus, etc. Next is the local examination. Local examination, under the local examination, the perineum for the infected episiotomy or the laceration, or any other like the speculum examination. Speculum examination means using the specula to visualize the cervix and the vagina. And investigation, like under investigation, swab and culture, then blood culture, blood picture, and urine analysis and culture. This is the diagnostic evaluation. So diagnostic evaluation, history collection, then general examination. So general, under the general examination we should do the vital sign checks. Then abdominal examination is abdominal rigidity is there or not, or tenderness, or uterine size, uterine tenderness, etc. And local examination means the perineum for the infected episiotomy or laceration, or lochia for amount and the color and odor, etc. And the investigation means the swab and the culture, blood picture, and the uterine analysis. So next we will see the treatment of this postpartum or the puerperal infection. So first is the isolation in a separate room or the fever hospital. Diet means a light diet rich in vitamin and mineral, supportive treatment like respiration of the fluid and electrolyte balance. Analgesic, it help to reduce the pain, and antibiotic to reduce the fever, and antibiotic it is fight against the bacteria. So it is the treatment, it is a common treatment of this postpartum infection. My topic, postpartum infection or the puerperal infection. It is a type of infection that is occur after the baby birth or baby delivery or the postpartum period. It caused by bacteria, viruses, or infection due to episiotomy or the laceration, or the infection in the placental side, or any previous infection in genital tract, or infection in the throat, or the urinary tract infection. And the risk factor are the cesarean section, urinary catheterization, and episiotomy. And the sign and symptom of this of this disease, like fever, pain, and general symptom. Under the general symptom like vomiting, nausea, and loss of appetite, etc. How can we detect that this is the infection, postpartum infection? So through the history collection, general examination, and the investigation like swab, culture, blood culture, etc. Then treatment means isolation. So patient should keep in a isolated room or the separate room or fever hospital, and should provide the light diet rich with the vitamin minerals, and should provide the medication like the analgesic, antipyretic, and antibiotic therapy.